I'm Nicholas Thompson. I'm CEO of The Atlantic. It is my great pleasure to be here with Dr. Jay Schnitzer, the Chief Technology and Medical Officer of MITRE, and Dr. John Halamka, Mayo Clinic President of Platforms. Hello, Jay. Hello, John.
Hey, great to see you.
All right, first question. So clearly, one of the things we need to do is to get the vaccine hesitant people to get vaccinated in this country. And last night I was playing soccer, and afterwards I was talking to one of the guys I was playing with, and he said he hadn't gotten his vaccine. Everybody else has at least signed up for an appointment. And he said, well, I'm worried about the health effects. I don't trust authority. I had a conversation that probably a lot of people have had. I said, well, you're going to need to get a vaccine if you're going to go to a Nets game, because you're going to need to show it on your medical credential, or what some people call the vaccine passport. So help me understand, is having verifiable information showing that you've gotten a vaccine on something, is that going to be a key tool in getting everybody vaccinated?
We've known for several months that vaccines are the way out of this pandemic. There are lots of other things that help us bridge to that, but getting vaccines at scale into the population with adequate vaccination is the only way to get out of this pandemic. And right now in this country, we are in a race between vaccination and variants, and we have to win the race. We have to accelerate the rate of vaccination such that we suppress the variants. If we fail to do so, we're going to be in very serious trouble. And when they are vaccinated, there will be occasions, if they so choose, when they want to do something where they will be asked for proof that they've been vaccinated. We want to make sure that at their full control, and only if they want to, having been vaccinated, they can produce a credential that verifies that they have in fact been vaccinated.
So imagine that, to Jay's point, with my choice, I want to go to a concert. And the concert has said, well, you could be vaccinated. That's one kind of credential or verifiable information. Or you could have, say, a PCR test that was negative within the last 72 hours. Or we have this on-site testing, and we'll test you here. Your choice, right? All up to you. Society needs a way of producing, for entry into such events, verifiable clinical information that the individual controls, right? This is not about government tracking or some corporate database. So we've worked together now with over 300 organizations to produce a free open source standard that enables the presentation by the patient, by the consumer, of signed, digitally validated information. If I got my test at Mayo Clinic, it's signed digitally by Mayo Clinic, and when I go to an event, it's checked against Mayo Clinic signature to make sure it is valid, and that in fact, I am presenting a credential that is a reasonable way for me to get into such an event.
And when we talk about this app, whatever it is, if it turns out that this app can be built quickly and work extremely well, but only on high-end Android phones and iOS phones, is that a good thing or a bad thing?
I am very concerned about the digital divide, disparities, and equity. So as we designed this, what we said is it needs to be rendered on a piece of paper with a QR code that embeds that digital signature that anyone can get for free and carry with them anywhere with zero technology investment. How do we meet the patient, the consumer, at their level of income and technological comfort?
This has some similarities to the contact tracing apps that were a bit of a failure in this country. Explain why this might work where the contact tracing apps failed.
There's a fundamental difference between what the contact tracing apps are designed to do and how they do it and how they engage with the healthcare system and what this kind of credential is all about. This kind of credential is for the individual, under the complete control of the individual, and has the individual's information contained in a very safe, respectful manner. Contact tracing is all about public health. And it's all about having public health agencies and officials have access to the data. Big difference in terms of how it's handled. And that's why one is going to be very successful and the other one not so much.
Let's go to a different topic, which is what we've learned during this pandemic that will, God willing, help set us up better for the next pandemic.
we have, in the last 20 years, digitized our healthcare system. Doctors and hospitals have electronic health records. So that means we're capable of extracting data and analyzing that data to deliver knowledge, new cures, new treatments. In the first few weeks of the pandemic, we started asking clinical questions like, what was the efficacy of an anti-malarial drug, hydroxychloroquine? We were able to go out to the hospitals of this country and in an anonymized, aggregated way, ask them to submit data to an analytical engine to determine that these anti-malarial drugs really didn't help so much. And we did all this from start to finish in 2 weeks. And so what it illustrates is that a properly instrumented healthcare system with the right urgency can discover new knowledge in very short time for very low dollars.
And I'll just add to that about mRNA and other new platforms. Yes, we've absolutely learned about new platforms that we didn't have before a year ago, and we didn't even know whether they'd work. And we now know that we can create new countermeasures, vaccines, drugs, therapeutics, even diagnostics, what have you, on platforms that are based on chemistry, not based on biology, that'll be far faster and more reliable. We've learned, if we compare what went on in this pandemic versus some pandemics over the last 20 years, 80% of the findings in those previous events in the after action reports and 80% of the recommendations are going to be true for this one too, which means we haven't really learned yet from the past. And this time we got to make sure we learn. We have to be able to carry them out.
There's nothing like a sense of urgency to bring people together. And so to give you this concrete example, on March 13th of 2020, Jay and I just started getting email from a number of colleagues. By March 20th of 2020, we had 1,000 companies working together with the MITRE Corporation serving as an independent facilitator, right? It's a nonprofit person in the middle that everyone just could trust. And we were doing this for the benefit of society with the hegemony of none. It was no cost to anyone. It required no legal agreements. It only required the willingness to be helpful. And that lesson learned, this coalition building, has been, to me, one of the great takeaways of the COVID era.
And it's been, the COVID era has been horrible and immensely painful. But what are the other things that we've gained from it?
We've learned how valuable telemedicine and telehealth are and how it can be used at scale beyond anything we've done before. And that's going to endure.
But it isn't so much a technology that we will now use forever. It was a cultural change. And I use the example of my almost 80-year-old mom, who is not a technology guru. And she, over the last year, said, well, by force of fear and convenience and access, I've learned to see my doctor and get 100% of my healthcare virtually. And I like it, and I want it to continue. And so as Jay and I did surveys with our telemedicine task force, what we discovered is over 75% of people in this country engaged with their clinician, had a great experience with their clinician, and want that to continue in a virtual way. So, wow, how often do you see a cultural change in 10 months?
And you think that the spread of telemedicine and some of the advantages we've seen in how research is done will also apply around the world? We're at this moment right now where it feels like we're starting to get the crisis in hand in the United States, but it's now massively out of hand elsewhere.
I am caring for patients in India personally. And that is because we're global. And I am asked questions like, what's the right dose of this med? What would you expect the lab value for this or that to be? And I am doing that in real time remotely from where I'm sitting outside of Boston to colleagues in India.
And this global aspect is really important, not just for the care of patients, but also for lessons learned. It's because of allowing larger gatherings and people to abandon masks and other things that we know work in this setting. This is not only is it a humanitarian crisis for India, but we here in the States need to learn from it too. This is a cautionary tale for our future. If we don't win the race, back to your friend who's reluctant to get vaccinated, if we don't win the race between vaccines and variants, we've got to win that race. we are at risk for exactly what India is experiencing.
Well, that is the perfect note to end on. Thank you very much, Jay. Thank you very much, John. I will go out to the soccer field tonight and try to do my part to get more people into the vaccine line.
Thank you, Nick.
Be well.